Good day, everyone. Thank you for watching our replay on the idea model of giving effective feedback. So we have chosen a scenario where one intern is interacting with a patient in a busy OPD setting. So we have a 63-year-old man, Mr. Jayaprakash, who is anxiously pacing back and forth, waiting for his turn. He checks with the hospital attendants every few minutes whether the doctor is available or not. So an intern, Dr. Randeep, calls out Mr. Jayaprakash's name and he rushes to the doctor's cabin. Dr. Randeep?
Yeah. Good afternoon, Dr. Mr. Jayaprakash. I am Dr. Randeep and I will be your physician today. So what brings you here, Mr. Jayaprakash?
Doctor, I have been having a chest pain for the last week, and it lasts for a few minutes each time.
Okay. So tell me something. Can you tell me something more about the pain? What is it associated with? Any physical activity, or is it relieved by rest?
No, doctor. It happens anytime, whether I'm resting or active.
Mr. Jayaprakash, let me do one thing. Let me just examine you first. And based on your, let me just do an examination first. Yeah. Okay. So based on your examination and symptoms, I would like to suggest an ECG to rule out any heart-related issues. Okay.
Okay, doctor.
So now we have got the ECG report. So Mr. Jayaprakash, your ECG actually seems to be normal, and but still, I'm not very convinced. I would like to still do a stress exercise test to rule out any heart-related issues.
So this stress test is done, and after the stress test, Dr. Randeep consults with his senior Dr. Reddy and informs Mr. Jayaprakash that he has a reversible ischemia. Dr. Randeep?
Yeah. Well, Mr. Jayaprakash, your TMT is suggesting that, during the exercise test, the heart is actually not getting enough blood. And, we need to check for the blockages in the arteries and supplying your heart. And this whole procedure is called an angiogram.
Doctor, I'm not sure if I should go ahead with the angiogram. Can I get a second opinion, please?
See, Mr. Jayaprakash, I have consulted my senior. And, based on the ECG, based on the test that we have done, we follow our departmental protocol. And we have done everything correctly. There's nothing wrong about this.
Doctor, I understand, but I've been seeing my family doctor for the last 20 years, and I would like to talk to him before making any decision.
See, Mr. Jayaprakash, I cannot wait or, wait for you to talk to your family doctor and then come back to me. This is a very serious issue and we need to take immediate action. That is very simple. And if you are not going to comply with our protocol or our, whatever our findings are, then you may do whatever you want to do and you may just leave. That is it.
So, dear friends, Dr. Randeep sends Mr. Jayaprakash away, unfortunately, leaving him confused and distressed. So we are now going to the part 2 of the feedback, where the actual feedback is being given. So Dr. Reddy was informed about the entire encounter of Dr. Randeep with the patient Mr. Jayaprakash by the attending nurse. And Dr. Reddy thought that it would be a good opportunity for the intern to learn from his mistakes and give him a chance to improve himself by giving him feedback. So Dr. Reddy calls Dr. Randeep to his office. Dr. Reddy.
Hi, Dr. Randeep. How are you doing today?
Sir, I don't think so. I'm doing very well.
What happened?
So I had a patient who was being very difficult and actually, he would not comply to whatever the protocol we had decided upon and he was being very difficult.
Can you tell me a little bit more about the story? What happened?
See, sir, what happened was the patient was complaining with the chest pain. So, as you're aware, sir, and as what we do routinely with patients, I ordered for an ECG. And following that, I ordered for a stress test. The stress test showed that the patient had a reversible ischemia. And I recommended him to undergo the angiogram as we do it. But he said he wanted a second opinion, and that he needed to talk to his family physician. And when I explained the situation to him, he got very upset and refused to cooperate. And I was not able to take it any further, and I just told him to leave the the OPD.
I'm so sorry to hear that, Dr. Randit. But sometimes it's important for us to remember the patients are often scared and they're worried about when they come to the hospital, especially when it comes to the matters of the heart. Now, they may be unsure about the condition and what the next steps are. And, sometimes it's our job as doctors in order to communicate with them effectively and also empathetically. Well, some of the things you can do when you speak to them, you can actually start the appointment by actually making good eye contact. You can let them know that you're listening. Let them be aware of your body language, sit down and speak to them face to face in a direct position. You can be curious about your patient. Whatever their worries are and their concerns are, you can document it down. This way you can actually show support and you can look at deeper ways in order to empathize with your patients.
I understand, sir, but sometimes it is very hard to know what to say and how to react to such situations.
Yeah, I know it can be tough. And that's why it's important for us to reinforce the nuances of empathy and compassion in patient care. We need to put ourselves in the patient's shoes and sometimes show them that we care about their well-being. One way to do that is by using effective communication skills.
Yeah, that makes sense, sir. And so, sir, how do I improve on my communication skills? We have not been taught about all this in our medical curriculum.
That's right. It's good that you asked, actually. Well, for starters, I'd like to share some videos. We've had some videos of some interns explaining the steps addressing patients using empathy. I can also provide you some of the material that we give to the interns in order to reinforce the importance of empathy in patient care. Additionally, I'd like to remind you, in the future, you should not take any offense and send the patient away, as this is not the right approach, We, as doctors, we need to be patient and try to understand the concerns.
Yeah, thank you so much, sir. I really appreciate. And I will keep in mind as the words that you have said, and will take appropriate steps to improve my communication skills, be empathetic to the patients, and effectively communicate what is needed.
You're very welcome, Dr. Randit. Now, just remember, effective communication with patients is crucial for the well-being and in building trust. Keep practicing, and I'm sure you get the hang of it. We should make a special checklist for assessing interns regarding effective communication, and maybe we'll look at it and review these communication skills in a couple of weeks' time. Is that all right?
Yes, sir. That's absolutely fine. Thank you so much, sir.
You're welcome. Take care.
Yeah, thank you.
Now we have come to an end of this role play. So in the part 2 of the feedback, you can see that all the 4 letters of the IDEA model, that is I for identify, D for describe, E for encourage, and A for action, have been well demonstrated in this second part of this role play. So for the identify, Dr. Reddy had clearly identified that Dr. Randeep had a problem of communicating effectively and empathetically. Then he described what all he needs to change in his behavior so as to become more effective clinician. And then he encouraged him also so that it is not a big issue and he can easily change those with practice. And then they agreed upon some action points. For example, Dr. Reddy had given him some video links and also reading material so as to know what are the nuances of an effective communication and empathetic communication. And they again decided that after 2 weeks they will again revisit the issue and they will use some checklist to see if effectively he is able to communicate later on. So this is about today's role play. Thank you for joining. Good day.